So, good morning, students. We are going to study coronary artery disease, the lecture third, and today we will discuss on myocardial infarction. Here we will study about different types of myocardial infarction here, and some treatment and some rehabilitation process which is required for the patient suffering from myocardial infarction. So let's know about what is myocardial infarction. Myocardial infarction is a disease caused by reduced blood flow in a coronary artery due to atherosclerosis and occlusion of an artery by an embolus or thrombus. So here we have understand that this is a disease condition which is which start from atherosclerosis process, and in addition to atherosclerosis, if there is an occlusion in the artery because of the embolus or thrombus, so this results into the myocardial infarction. And this is abbreviated as a MI. MIM means myocardial, I for infarction, or this MI is also known as heart attack, which is irreversible damage of myocardial tissue caused by prolonged ischemia and hypoxia. What is ischemia? So we understand yesterday that ischemia is a inadequate blood supply to the tissue, or lack of blood supply to the tissue, which is ischemia. Hypoxia is another term we are knowing today, which means decreased oxygen supply to the tissue, that is a hypoxia. So this both is a subsequent process. First of all, there is a ischemia, where the blood supply is approximately stopped, and this leads to hypoxia because there is no supply to the oxygen to the tissue, and you know that blood is blood transport oxygen. So if there is no supply of blood to the tissue, so there will be the hypoxia in the tissue. That is a less oxygen tension in the tissue. So both of this leads to irreversible damage to the myocardial tissue, and we know this condition as a myocardial infarction or heart attack. We'll know the pathophysiology here. Let's know from here the atherosclerosis, which is a thickening of the artery or blood vessels because of the deposition of cholesterol and fat in the wall of the blood vessels. So atherosclerosis gradually causes obstruction in the blood vessels, okay, where the lumen of the artery which undergo atherosclerosis process, so lumen become narrow, and this is a gradual process, slow and steady process, and sometimes it can cause obstruction, which leads to ischemia. Ischemia leads to hypoxia, and there is a reduced oxygen demand, so reduced oxygen in the tissues, and it can cause angina as a sign, chest pain, right? Similarly, thrombolysis. Thrombolysis is a breakdown of thrombus, a clot. So this may obstruct in the narrow arteries, which is because of the result of atherosclerosis process. So thrombolysis can obstruct the further arteries, and it can cause unstable angina. That is unstable chest pain. This is not a continuous but unstable. Sometimes it causes chest pain, again it becomes normal, so again it becomes sometimes chest pain. So it's unstable because thrombolysis process takes place, maybe through medication, maybe the host on response that break down the thrombus. The permanent thrombus leads to necrosis. Okay, necrosis of the tissue, because there is no oxygen supply, there is no nutrient supply, and there is a cell death, and cell death results into necrosis process, and where we call it as a myocardial infarction, right? So similar process occurs from here also, this mechanism also, where there is an arterial spasm, where there is a tightening of the arterial muscle, which may becomes because of the sudden process, and this is reversible, and it causes obstruction here, and the obstruction, the spasm causes obstruction of that particular artery. Then again, this leads to the same phenomena and causes myocardial infarction. Okay. Here, the third mechanism here we know here, the atherosclerosis plus plaque split. The plaque which is formed in the atherosclerosis mechanism, it rupture, it is split, and because of that, it causes activation of the platelets, and it causes clot formation inside the narrow artery. So this is a thrombus. So three things you need to know: atherosclerosis plus plaque split, which is a plaque rupture. Then in addition to this, there is a thrombus also. So together can cause sudden occlusion of that artery. Okay. So it's not a reversible, usually reversible process. It can cause ischemia, hypoxia, necrosis, and again myocardial infarction. So these are the three ways that a person may undergo myocardial infarction process. Let's know about types of infarct. Basically the artery which has involved. So that artery undergo through the obstruction process. So blood supply is stopped, and finally there is a necrosis, what we understand in the previous slides. And here we are going to know the different types of infarct. What are the different types of myocardial infarction which is recorded till date? We'll study the different types of infarction. Now this is according to anatomic region of left ventricle involved. We have the left ventricle, right ventricle in the heart. So now this is basically infarct oriented to the left ventricle. Okay, and here we are going to know the anatomical terms. Okay, or anatomical region. Okay, this anatomical region of left ventricle represent the different types of infarct here. First is anterior, which means they're anterior to the left ventricle. So the artery which is anterior to the left ventricle may undergo atherosclerosis or arterial spasm, or the third one that we studied, that is the atherosclerosis, plaque rupture, or thrombus. All three mechanisms can occur in the anterior artery of the left ventricle. So we are talking about the anatomical region of left ventricle where the infarct has occurred. So anterior, posterior, lateral, septal. So there is a septal which divides ventricles or atrium, right? So there are septal artery which may undergo through the myocardial ischemia. It leads to myocardial ischemia and the hypoxia, and then necrosis, and then myocardial infarction. Circumferential, where we say that the surrounding, the periphery artery may get affected, and this is the combination where anterolateral or posterolateral or anteroseptal. So these are the anatomical region of left ventricles which are usually affected, and this leads to infarction in the patient body. Next classification we are going to know. This is based on degree of thickness of ventricular wall. Okay, so ventricular wall, we should know that what is the thickness of that. So here the first one is a transmural. Transmural, this one we can see the transmural where the full thickness the entire thickness is, we can see, and it is affected. This is the left ventricle. So left ventricle entire muscle, okay, it's involved, and it's affected, which undergo the tissue damage, and this is called as a transmural or full thickness, infarction. Second one is the endocardial, or also known as laminar. So here we see that it is related to the nearby the lumen of this, this cavity of this left ventricle. So from the inside, laminar or luminal type. So it's through the endocardial, subendocardial muscles. Not endocardial, subendocardial muscles are usually affected, and we call it as a subendocardial infarction. So this indicates the thickness of ventricular wall which get affected. So transmural is a very severe form, whereas subendocardial infarction is incomparatively it's a less severe, because only part of the this ventricular wall is affected. Here the full ventricular wall is affected, we can see. Next classification is, it's according to the age of infarction. So age of infarction, so here it can be of two types. One is a newly formed, recently there is infarction, the new infarction, which can be acute, which can be recent, which can be fresh. And another can be the advanced infarct, and that is because of old gradual process, or that can be old infarction which has which has healed or which has reorganized. So this is the newly formed or advanced infarct. So this is based on the age of the infarction. It means there is a infarction process, so we call it as a newly formed, the fresh infarction, or we can say the aged means or old means it is not a newly formed. It has occurred from last month or from years. So the patient might have the history of the infarction process. Now the types of infarction, this is the classification proposed by third universal definition of myocardial infarction. So here, based on the universal definition of myocardial infarction, this classification, there are 5 types of infarctions are there. This is type 1, which is a spontaneous type. Type 2, this is supply or demand mismatch. Type 3 is a suspected type. And type 4, we have A and B, which is PCI, which means percutaneous coronary artery intervention. Type 4B is a stent thrombosis, and the type 5 is a cardiac surgery. Now here, let's know what is the type 1, which is, we are calling it as a spontaneous. Now here in the spontaneous type of myocardial infarction, or type 1 type of in myocardial infarction, what happens? There is ischemia caused by primary coronary event. Okay, primary coronary artery. The coronary artery. When it undergo through the plaque rupture. Okay, resulting in coronary thrombosis. So this is the primary reason where the plaque formation takes place, and this is the gradual process, it's spontaneous process. Okay, right? Here it's an event. It's an event. So primary event of the coronary artery, which occurs during the atherosclerosis process, where a plaque may rupture and initiate the thrombosis mechanism, which causes obstruction. And this obstruction leads to ischemia, and this is what we call as a type 1. Type 2 is a secondary to ischemia, means after ischemia, after ischemia, what happens? There is a increased oxygen demand, or there may be the decreased oxygen supply, right? So this is secondary to ischemia. Here there may not be the development of the plaque or atherosclerosis phenomena, right? Uh, the ischemia may have developed because of something different other than atherosclerosis mechanism, right? So here in its first type, we have atherosclerosis, which leads to, thrombosis, obstruction, and ischemia, and then finally necrosis and myocardial infarction. But here in the type 2, it is not the process through the atherosclerosis or plaque formation. It is the process where the ischemia is carried out because of some different reason, such as coronary artery spasm, arrhythmias, embolies, hyper or hypotension. So this may be the reason behind the ischemia. So that is why we call it as a secondary to ischemia, which causes a mismatch supply or demand of oxygen. There can be the increased oxygen demand, or there can be the decreased oxygen supply. Because of this, there can be the cell death, and this cell death can lead to, the myocardial infarction sometime. Type third is, suspected type. This is suspected myocardial infarction, means there may not be the concrete diagnosis, because there is a sudden cardiac death or unexpected cardiac death. The patient usually got death, and when uh, when uh, when when the patient is taken to the hospital, so the patient doctor asks that what is the symptoms, or doctor analyze the history, signs and symptoms. So based on the signs or symptoms, we say that the patient might have undergone the myocardial infarction, right? So this is the type third, is a suspected type, and it usually occurs sudden, okay, and unexpected cardiac death takes place, where there is in addition to that, there can be the sign of myocardial ischemia represented by the patient, such as angina pectoris, what is a chest pain, where there may not be the evidence of definitive biomarker, or they not what the test we do, okay, the blood test or the radiological test, right? Maybe the echocardiography. So that process the patient may not undergo, because before going to the process, before going to the blood test, the patient usually died. So here we categorize that kind of myocardial infarction as a type third, which is suspected and the patient is already dead, right? And type fourth A is a PCI type of myocardial infarction, which is related to percutaneous coronary intervention. Means this is one of the technique which is used to cure the patient who are having atherosclerosis changes in the arteries. So stent or balloon is inserted in the affected artery, and because of this process, right, there may be the myocardial infarction. So this is a PCI, or what we say, P for percutaneous, C for coronary, I for intervention. So PCI associated myocardial infarction which occurs, so that is known as type 4A, or PCI associated. Here type 4B is a stent thrombosis, means when a stent is inserted into the artery which has undergone thrombosis process, or which has undergone plaque formation or atherosclerosis, and because of that inserted stent, that stent may stimulate thrombosis mechanism, and this thrombosis may trigger to cause myocardial infarction. So this type of myocardial infarction we categorize as a type 4B, which is related to stent thrombosis. Okay, the thrombosis triggered by the stent which has been inserted at the affected artery. Now type 5th is a cardiac surgery, related to cardiac surgery. Like the patient who have diagnosed with the atherosclerosis or abnormal coronary artery disease. So the patient usually may undergo cardiac surgery. So myocardial infarction associated with the cardiac surgery? Like one of the technique is coronary artery bypass graft. So here the patient when undergo through this process, coronary artery bypass graft. So because of the result of this process, the patient might have a myocardial infarction, and that kind of myocardial infarction is categorized as type 5, which we call as a related to cardiac surgery. So I hope you have understand this classification of infarction. There are 5 type of infarction related to this is what proposed by the third universal definition of myocardial infarction. Now, what are the medical treatment for this myocardial infarction? So there are 2 treatment. One we consider as a coronary stent, where stent is introduced. Okay, this is the what the normal, not normal we can say. Here we have plaque which has formation in the artery. So plaque before treatment usually causes the narrowing of the artery, and here the stent procedure has done to widen the narrow artery. Now the stent has inflated, and it has opened the lumen of this affected artery. So result after stent procedure, so we can see this the resumption of the blood supply. Now this become like a normal, and there is no turbulence in the blood supply in the patient who has undergone a stent procedure. So this is the one of the option, coronary stent option. Second option is a coronary angioplasty, where one catheter is inserted. Okay, and this is the artery which has a plaque. So this catheter is inserted near the plaque, and this is the guide wire which allow to go to the plaque area. So this is the balloon. So this balloon is when is inflated, so it will widen the narrow lumen. Now we can see this lumen which is here narrow, it is now again widened because of the balloon. So when we insert balloon, so this is process is known as angioplasty. When we insert stent, we say coronary stent process. Okay, so the 2 medical treatments are available here for myocardial infarction. Now this is a percutaneous coronary intervention. Let's know about this. What is the percutaneous coronary intervention? Here this is also known as angioplasty with a stent. Means the fusion of the what we discussed in the previous slide, that there is a balloon with the stent. Both of 2 things are applied into the into the artery which has undergone the plaque formation. And this is a non-surgical process. PCI, percutaneous coronary intervention, is not a non-surgical process. We do not do any surgery, and this is used to treat the narrow coronary arteries. And this uses a catheter, a thin flexible tube, to place a small structure called a stent. Stent is a small structure. Okay, so that is stent structure is they are placed on a narrow coronary artery using a catheter. Okay, function of this percutaneous coronary intervention is it helps to open up blood vessels in the heart that have been narrowed by plaque buildup. Okay, so this is the function of, or the application of this percutaneous coronary intervention. It helps to open the blood vessels which has been narrowed by the plaque. Okay, you can see here this is the approach we can do here. The percutaneous coronary intervention can be done either through the groin region, okay, where the femur artery, where we can insert the catheter. or we can insert the catheter through brachial artery, which is near the arm. So or you can also insert this catheter at the region of antecubital vein region. Okay, and so these are the point where we can select to insert the basically alternative site. This is the primary site, this one, and this is the alternative site. Two sites are preferred, okay, to insert the catheter. Here we can see that the blocked coronary artery, this artery is blocked because a plaque, okay, and there is a blood clot also. So this is required to be treated so that we can prevent the complications. And because of this blood clot, there is no blood flow here, right? So now treatment is, we do insertion of a stent after balloon angioplasty. So first of all, balloon is inserted, and the balloon inserted, then after that the balloon also contains stent. This is the balloon, this is the catheter, this is the balloon, and this is the stent over the balloon. So balloon is first of all inserted with the stent, and the balloon is inflated, and here you can see that stent in place and blood flow restored. Now here we can see that the stent is only there. Here balloon and the catheter has been taken out, right? So this stent remained for longer period of time, and this is what we can cure the blood flow, which are usually obstructed in the patient who have this plaque-like formation. So we are not treating the plaque, we are just trying to open the narrow artery which has occurred because of the plaque, right? So this is the approach which can be done, we do in the percutaneous coronary intervention. Now here we have done that our catheter is inserted with the teeny inflatable balloon into your artery. So this is the catheter with the balloon is inserted, and using X-ray, video, and special dyes, the catheter is guided into the blocked coronary artery. So how this catheter moves forward. So this we can view either using X-ray or some video device, or using some special dyes. So this gives the idea that how the catheter is moving forward and going to the artery which is affected. So once it's in position, the balloon is inflated to widen the artery. So this is what the procedure we are knowing for percutaneous coronary intervention. Here, when the position, when the catheter comes in the position, the balloon is inflated to widen the artery, and the fatty deposits of plaque get pushed against the wall of the artery. So this is what the balloon pushes this plaque against the wall of the artery, and this clears the way of blood flow. So this is what the blood flow can be get cleared. The blood vessels becomes widened because of this balloon. And in some cases, the catheter is also equipped with a stainless steel mesh called stent. So this is the stent is made of a stainless steel, okay, and it's a mesh-like structure. And this stent is also equipped with the balloon, okay, in the catheter. And the stent is used to hold the blood vessel open. So it always holds the blood vessel open, and it can remain in place after the balloon is deflated or removed. So when we remove the balloon with the catheter, so the stent will remain at the same place, and it will hold the blood vessel to open it. So once the balloon is out, your doctor can also remove the catheter. So this is what the procedure we have understand about the percutaneous coronary intervention. Okay, this procedure may take half an hour to several hours. Now there are thrombolytic therapy, here also called as fibrinolytic therapy. So the patient who has undergone the myocardial infarction because of the thrombus which occluded in the lumen of this narrow lumen of the affected artery. So usually some medication is given to the patient which causes fibrinolysis or the breakdown of the clots. So breakdown of blood clots formed in blood vessels using medication, what we call as a thrombolytic therapy. Okay, here there is the blood clots which comes in between the this narrow lumen caused by the plaque. So that thrombus are usually broken down using the medication. Thrombolytic agent is also known as clot busting drugs and are commonly used as a medication. Okay, so thrombolytic agents we call as a clot busting drugs. Now, what drugs are used in thrombolytic therapy? So you need to remember that some few drugs which are used in the thrombolytic therapy where the thrombus clots are dissolved. So imminase or antistreptylase, retabase, streptase, TPA, PNKs, evokinase. So these are the drugs of choice which can be used as a thrombolytic drugs. Now, surgical treatment, some procedure we can undergo so that we can correct the plaque-like formation. Okay, because of the plaque, there can be the obstruction and there can be the damage to the heart muscles. So, what is the surgical treatment procedure? Let's know about this. So, it's also known as coronary artery bypass surgery. Okay, this surgical treatment. Okay, the most common surgical treatment for myocardial infarction is a coronary artery bypass surgery. Okay, here the most commonly we call it as a the technique we call it as a coronary artery bypass graft. What we do here, a surgery that restore the blood supply to the heart using a healthy artery or vein to bypass a blocked artery. So here we do the bypassing of the blocked artery. Okay, we take a healthy artery or healthy vein, and what we do using this healthy artery and healthy vein, we just bypass, we insert, we join the arteries and bypass the blocked artery. Okay, so here this is the surgical process actually, right? So this is the what we do here. We can pick the vein and artery here. Now let's know the cardiac rehabilitation. What is cardiac rehabilitation? This is also called as cardiac rehab. Okay, the most very important procedure. Okay, the patient must undergo after the myocardial infarction or the myocardial infarction treatment. So it's a medically supervised program actually. Cardiac rehabilitation is a medically supervised program for people who have had heart attack, heart failure, heart valve surgery, coronary artery bypass grafting, or percutaneous coronary artery intervention. Okay, so when the patient has undergone through this in this pathological process, so those patients are medically supervised through a program called as a cardiac rehabilitation. And here in the cardiac rehabilitation, it helps you to adopt heart healthy lifestyle through exercise, training, and education. So patients are usually counseled through exercise, through training and education, so that they can adopt a heart healthy lifestyle. And they are also prepared to address some risk factor for cardiovascular disease. Like if there is a cardiovascular disease in future, so they are also prepared to address such situations. So we have studied myocardial infarction, the types, the treatment, and the medical procedures that can be required, and and the last we have studied cardiac rehabilitation. Now we have come to the end of the slide. Now, if you have any questions, please ask me. Is there any question?